Hi, I'm Dr. Erica Schwartz, and today I want to continue the conversation about the evaluation of the Nurses' Health Study that was in the news this week, where the cancer researchers and the cancer experts discussed the fact that estrogen is bad for us, may cause cancer, and the head of Sloan Kettering, breast cancer, Larry Norton, said that he would never prescribe estrogen. And I want to beg to make an exception here for you to listen to better understand, because the information you're given really serves only to scare us instead of giving us true, useful information. Indeed, the Nurses' Health Study was a long study that looked at nurses how they develop breast cancer over a course of 20 years, from 1978 to 2008, actually 30 years. And it turns out that the women who were taking synthetic hormone replacement therapy, as in Premarin and Provera, had a higher incidence of breast cancer. Nobody looked at bioidentical hormones, estradiol and progesterone, in those studies. There is nothing different than the Women's Health Initiative, which came out in 2002, that also studied Premarin and Provera and found the same findings, that with synthetic hormones coming either from the lab, Provera, or from pregnant horses' urine, Premarin, women have a chance of increased risk of breast cancer. But the problem here is that before you have breast cancer, before you get breast cancer, there are a lot of steps, and everybody's talking as if we all already have breast cancer. 20,000 of us die a year of breast cancer. I don't want to be one of them. I don't want you to be one of them. But I want you to understand that what I'm talking about is prevention. And prevention is not about getting breast cancer, it's about preventing breast cancer. When you want to replace your hip, you don't go to a brain surgeon. So if you want to understand prevention and the use of hormones in prevention, you do not ask a breast cancer expert to tell you about hormones. Hormones are in prevention, is what I do, and physicians in the area of bioidentical hormone research and bioidentical hormone prevention, alternative, integrative, functional medicine, integrative complementary medicine are the people who are the true experts in prevention. Prevention is really important because while 20,000 of us die of breast cancer a year, and we've been so scared about breast cancer and the connection to hormones, there are 300,000 of us who die a year of heart disease, which is totally preventable with the use of bioidentical hormones, estradiol. If you think about it, when you're 20 and you're full of hormones, when you have a lot of estradiol in your system, you do not have a risk of heart disease. And your risk of breast cancer and other chronic illnesses of aging is very low. So it's the type of hormone replacement therapy, not the fact that hormones cause cancer, but rather the type of hormones that you use and how to use hormones in prevention, not after the fact once you got breast cancer. I hope I made it a little clearer and I made you a little less scared, and I've steered you in the direction of prevention and working with a doctor who's right for you, who knows about bioidentical hormones. Thank you.